Here at University of Pittsburgh, we perform all types of different operations and procedures to take care of patients with medically intractable epilepsy and also with patients with movement disorders that do not respond to medication. We have different type of techniques, mainly non-invasive, that allow us to perform the treatment of patients with movement disorders and also with epilepsy using a less invasive or a minimally invasive approach. More specifically, we develop techniques here in our hospital and university that allow us to really recognize the smaller portions of the brain that are responsible for the seizures. In that way, if we know that is a small area that is causing seizures, we can go there, and by performing a small procedure named laser ablations, we can go and guide our laser catheter to the areas where the seizures are originating and perform what we call an ablation. In that way, patients will become seizure-free without the need of any larger procedures or any large admissions or long admissions to the hospital. From experimental and from more research aspect, what we're doing here is developing also new techniques to treat patients with stroke. Many times patients with vascular events, for example strokes, they do have weakness in the arm, legs, and speech, and this weakness normally stays for long periods of time. By developing this method, we can perform the neuromodulation or the implantation of small electrodes in specific areas in the brain. In that way, we can modulate the symptoms that those patients they have the stroke with the recovery of the strength of the arm, the speech, and also the leg. So this is another interesting aspect of our practice that is going to become available very, very soon with upcoming clinical trials in order to access the feasibility and the safety of those procedures.